Welcome back. We're here with a familiar face, Hilton Raethel, president of the Healthcare Association of Hawaii, who has been helping shepherd us through so many things through the COVID era and beyond. Thank you so much for being with us.
You're welcome.
Top of mind right now, you did a study having to do with healthcare shortages. We thought it was bad during COVID, and it's gotten worse. What have you found? Why is it important people know about this?
Well, it's very important because we need a lot more healthcare personnel than what we have in a number of different areas. We did our initial statewide report in 2019, and at that point in time we identified about 2,200 open non-physician patient-facing healthcare positions. And in our latest study, which we conducted earlier this year and which we literally just released yesterday, we have almost 3,800 open patient-facing positions in the state of Hawaii.
That's just a precipitous fall. How can you make up that ground? What are some of the strategies to fix this?
Well, we're working very, very hard. We entered the pandemic with that shortage, and we've been working hard during the pandemic. But what has been happening is that the need for healthcare workers has actually that has increased. And so all the efforts we have are working. There is a lot of different initiatives. We're working very well with all the educational institutions in the state, from high school, community colleges, universities. We just need more people. It's a great career and a great profession.
And you have some entry pathways for kids as young as high school. What about people who want to change careers? Is it ever too late to think about a career in healthcare?
There are multiple entry points for healthcare, and that's one of the great things about healthcare. You can get in, there are students who get certificates in the public high schools or at Kamehameha schools, and they can get straight into the workforce when they graduate from high school. You can get in with an associate degree, with a certificate, one-year certificate course, undergraduate, graduate, multiple entry points.
Okay. We're also seeing our hospitals and our clinics full of primarily kids and others with the RSV, sometimes a mix of RSV and flu, and then COVID is still out there. How severe is this RSV and flu this season?
Well, just looking at COVID, we have about 60 to 70 COVID patients on any given day. Many of those are incidental. So COVID is not a major issue for our hospitals right now. We are seeing an increasing incidence of flu and RSV. Now, fortunately, the RSV levels, especially for our young children, are manageable. However, our clinics and emergency rooms are seeing a much higher volume of RSV and flu, but it's not translating into significant numbers of inpatient admissions.
Well, that's a good thing. So parents just keep an eye out, know the signs.
That is correct, yes.
Okay, sure. Now, COVID, we're so used to getting our shots for free, getting some of our tests for free, being able to go see the doctor or a clinician if we've come across COVID in our lives. That's coming to an end from an insurance coverage point of view or from the federal government support of it. Can you tell us financially what's going to change here at year end and why the public needs to know about it?
Well, the federal government has been funding tens of millions or hundreds of millions of dollars throughout the pandemic, and they have been covering all the testing, they have been covering the immunizations, and they've also been covering all the therapeutic agents. However, all those funding sources are running out. So starting in January, the coverage will revert to what people normally have. So if you have commercial coverage, you may have a copay, for example, so it will fall under your commercial coverage. Now, Medicaid, there's no copay for Medicaid, but for Medicare or commercial patients, there may be a copay for whether it's immunizations, for the therapies, or even the tests.
All right, and if you're uninsured, of course, there's no safety net there for you as it relates to COVID come the year end?
Well, we're very fortunate in Hawaii. We have a very low uninsured rate. It's probably about 3% right now. And there are some community health clinics, for example, that are still able to have some of those supplies, and they could provide coverage for those individuals.
Okay, but if people haven't gotten their shots yet or haven't gotten their boosters and want to before year end, might be a good time to do it?
Well, it's a great incentive to get that booster, to get their flu shot now while it's still being covered.
Sure. All right. Well, thank you. Is there anything else you want the people of Hawaii to know or related to all the things you're looking out from on your horizon?
Well, we're working very, very hard to make sure that everyone in Hawaii gets the care that they need.
Thank you for the work that you do.
You're very welcome.
And we'll send it back to you.